This conference will now be recorded.
Okay, and let's see, we also have media here. I see Jacob Lewin from KMUN, RJ Marks, I believe, from Seaside Signal, where he was here, Ethan Myers from the Astorian. I think that's who we have on the line right now. So we'll start off with Susan from Seaside School District. If you have just a quick opening statement or information you wanted to share, and then we'll see if folks have any questions specifically for you on the schools and how you're handling the COVID.
All right. Good morning, everyone. We're really glad to be here, and very happy to have all of our students, pre-K through 12th grade, in school. Full-time every day. We began on September 7th, and we have very similar health and safety protocols in practice this year as we did last year to keep all of our staff and our students in place. And as most of you know, those are the protocols for screening our students as they come in, whether that be a physical screening with our elementary students and a sign-in screening that our secondary students do each day. We work really closely with our district nurse for any students or staff who have symptoms, and erring on the side of caution for anyone who is not feeling well to stay home, and that's working really well. We are also taking any precautions in transportation with keeping students at a distance from each other and having windows down so that we can have as much fresh air coming in. So all of these kinds of precautions are really important. Communicating with our families. In our buildings, we practice that physical distancing as well as a lot of cleaning throughout the day and windows open in classrooms. And I really appreciate the information we get from Oregon Department of Ed. And I think of the visual maybe that some of you have seen of slices of Swiss cheese lined up. And with every protocol that we put in place, we have less holes in the Swiss cheese, and that just keeps everybody safe. We are really fortunate in our district to have about 92% of our staff vaccinated, and this is a wonderful thing. We have extra protocols in place for our unvaccinated staff so that they are safe and those around them are safe. And so we're confident that our school year has started out well, and it will continue on in a positive way. So thank you.
All right, thank you, Susan. Do any of the reporters have any questions specific to Seaside School District or for Susan? If you could just identify yourselves and then ask your question.
Yeah, this is Jacob. Susan, what's attendance like, and can you tell me a little bit about how things are different now from when you were doing it in person in the spring?
Different in what regards?
In your protocols, is it a full school day? You still doing the cohorts? Difference in testing? Anything? Any major differences?
We are a full day, and when we were a hybrid model, we had our high school and middle school students every other day. Now they are here full days. 5 days a week, with the exception of Wednesdays, which is a 1-day early release. It's the same with elementary. In the spring, we were seeing all of our students in 2 cohorts, but they were only half days. So now they're full days once again, 5 days a week with early release on Wednesdays. Our protocols have remained very similar. We do have cohorts, and we have extra protocols in place. I will mention lunch times, because this is an area where students have their masks off and are eating. So we have put extra protocols in place, adding extra lunch times so that each grade level at the elementary school stays in a cohort. For instance, there's one lunchtime for first grade, one lunchtime for second grade, and so that they can physically distance at that time so we can keep them safe. And the same protocols at the secondary level for lunchtime.
And attendance is, how has attendance been?
Attendance is great. Our numbers are also a little bit up, so we're glad to see both students and families are excited to have kids back full time.
Thank you.
Any other questions for Susan? Okay, I'll go ahead and then give the other superintendents the opportunity to, give the opening statements or information. We'll start with Tom Rogozinski from Warrenton School District. Do you have any information you'd like to start off with?
No, well, first of all, thank you for the opportunity. I do want to start off with thanking Public Health Department. As we work with other superintendents across the state, it's pretty clear there's a wide variety of relationships, between the districts and their public health departments. And we were very fortunate to be working with Clatsop County Public Health Department. And I think that also shows in the data. The dashboard at OHA has pediatric data for COVID case rates, right? And then they present it in 2 fashions. One is the absolute number of pediatric cases per 100,000. And from my take, looking at it yesterday, I believe Clatsop County has the lowest rate of pediatric cases of any county in the state. Similarly, they break that out in recent weeks, in the past 4 or 5 week prism, case rates per 100,000 amongst youth. And again, we are amongst the lowest in the state. I think that has a lot to do with our public health department, their vigilance and their approach throughout the pandemic and our relationship with them. So I want to start with that. As far as our school goes, some of the questions that were asked echo all that Susan said in Seaside. We're doing all the protocols that we were doing last year with the same degree of vigilance that we held last year. We think the critical ones are, as Susan said, the screening at the front end of the day, making sure that those who are not feeling well or have something at home, maybe that is indicative of a case at home, that gets investigated. We slow that down to make sure we can look into it before they get in our doors. That's been huge. The mask wearing protocols have been absolutely essential, we believe, to keeping our kids in school. And last year, it's not so much of a change from last year. We were through the second half of last year, we were running 5.5 hours a day for every grade level, K through 12. And we were in our middle school and high school levels changing classes, and keeping an eye on seating charts so that if we had the contact trace, we could do that surgically versus broadly. And we're doing all those things this year, but our school days a full 7+ hours in all grade levels now. So we're appreciative of the opportunity to keep our students in school and forming those relationships with their peers and their teachers. One of the things we noticed when we were out of school last year for comprehensive distance learning because of, at the time, the state metrics, and that was mostly through last fall, the number of referrals we would make to our health and human services, students that might be perceived as being in need, was down a full 80%. So we only made 20% of the referrals we would typically make when we were in session. And last year, that plummeted with distance learning, and then it went back up when we got back into school, and it's back up this year. And I think it's indicative of that there are situations in which kids rely on their school and their teachers to sort of help them navigate some tough situations at home, and those situations are likely to get the support and the closer looks they need when we are in person. So I think it's important to balance not just the educational outcomes are huge and vitally important, and we know distance learning does not work well for every kid, but we also know that the health, social, emotional health of our students is better when we're in school, because we do give them the opportunity to get some of those situations ironed out. We're appreciative of that as well.
Okay, great, thanks. Next, we'll go to Steve Phillips with Jewel School District. See if you have any information for us.
Yeah, thank you. We were in school pretty much all of last year, and we started this year on August the 30th with our kids, and so far so good. We're running full days, pre-K through 12. Our attendance is better than last year. It's almost back to pre-COVID numbers. Protocols, same as last year, with maybe some little tiny tweaks here and there depending on classes. For instance, we have some classes with 16 kids, which for Jewel is a big group, and then we have other classes with 6 or 7 kids, and so we'll tweak here and there depending on those variables. By the governor's deadline of October 18th, I think we'll be vaccinated about a 90% rate in regards to our staff. And two last things is I totally agree with Tom in regards to the county and the health department. They've been great to work with. I know they're overwhelmed and working really, really hard, but they've been great to work with. And also my board's been wonderful to deal with. They believe that the best place for kids to be is in school. And so we need to do whatever we can do to get them in school. And so they've been extremely supportive, and the community's been great. And I think that's shown through last year with how long we were able to stay in school. And so far, so good this year. The last thing I'd mention is October 5th from 3 to 6 p.m. we will have a vaccination clinic here at the school, partnering with a dental clinic. And it's about the 5th or 6th clinic we've had at the school for vaccinations. So once again, it's October the 5th from 3 to 6 p.m. vaccinations here at the Jewel School. Thank you.
Great, thanks, Steve. We'll go on to Craig Hoppus, Astoria School District.
Thank you, and like others, thank you for the opportunity for us to have this today. I will also echo, and our work with the health department this year has been great. They are like spot on when we need them to communicate with us. And then our weekly meetings has also been helpful as we run through different scenarios and as things change. So I want to share that. We are also in person. I have been all school year. Excited to have kids back. We have very in-depth health and safety protocols in place that we abide by that allow us to keep kids in school. I'll share like what Steve did. My school board, the community, my parents, and my staff all want to be in person. We're going to do everything we can to remain in person. And we're working very hard to be able to do that every day. Whether it's continued to sanitizing, to distancing on transportation. We also have in Astoria, we have 2 nurses, but we also have medical assistants in each of our buildings to help support kids with symptoms or staff with symptoms. So we're really excited the work that they are doing. Like others, it seems like it's a trend. We're at about a little over 90% of our staff are vaccinated. So that's good to see. We have hosted a vaccine clinic in our district, and we'll looking forward to hosting more once the younger kids' vaccines come out. And I'll also mention our attendance is good, really good. It's the best it's been in the last couple of years. We also have provided an online academy for kids whose parents were not comfortable yet to send their kids back. We have about 100 kids in that academy. And some of those kids do attend a little bit of in-person, but most of them are attending online 100% of their day. But at some point, we want all of our kids back in school. So thank you.
Great, thanks. And we'll go to William Fritz, Napa School District.
Hi, and again, thank you for this opportunity to discuss the current situation in schools. I guess I'd like to start off by mentioning, due to the safety protocols that schools have currently and have had for the last year, schools are the safest place in the community for children to be. The likelihood of COVID spread in schools is far lower than the likelihood of spread in our communities at large. We in Napa have been operating in person safely for over a year now. During that time, we are pleased to report that our students last year, if you look at MAPS testing results, showed more than a year of growth in both reading performance as well as math performance in Napa. And we're proud of that. And we attribute that to being able to offer school in person. I will say, though, lately we have seen an increase in community spread of COVID, and that does have an impact on the school. We've had to quarantine some students this year already, more than we ever did all year last year, not due to spread within the school, but due to spread within the community. And that's posing a challenge for us as we enter the new school year. So I just want to mention and implore the community to be responsible during this time. COVID's not over yet. There still is a fairly high case count out there. And so if families want us to continue to be able to operate school in person, and we believe that in-person schooling is the best for students, we need to do what we can to reduce community spread. So that would mean wearing masks. It would mean, for students that are able to, getting vaccinated. And it also means responsibly communicating with the school. So if a student is sick, they shouldn't be coming to school. If a student is in a household or spending time with people who test positive, they shouldn't be sending their children to school. And unfortunately, in some rare cases, families don't communicate with us, and that causes us to need to quarantine a larger number of students. While attendance in Napa has been favorable this year, we're well above 92% in attendance. Most of the students who aren't in school is because we've had to quarantine them. And so I just want to encourage our communities to take the proper precautions, communicate well with their schools so that we can do our best work in educating students. So with that, I'm glad to address any questions, as I'm sure my colleagues are.
Okay, thanks, Bill. And we also have with us Elizabeth Friedman from the Northwest Educational Service District. So Elizabeth, if you have anything to share with us, go ahead.
Thanks. In addition to what's already been shared, just want to make sure that folks know that Northwest Regional ESD staff are present in all 5 of our school districts. We provide special education staffing some special ed staffing for the school districts. And our staff are expected to follow our ESD protocols, which include masking 100% of the time unless they're in a room alone with the door closed. But they also follow whatever the protocols are for the district, so including signing in and out for contact tracing, doing screening, etc. Our ESD, or all ESDs in the state, are responsible for providing services for all kids birth to 5 who experience any type of developmental delay or disability. So our staff is out in community preschools that are opening or consulting virtually if they're not opening yet. We are not yet doing home visits, which is where a majority of our birth to 3-year-olds services are held. But we are able to meet families in outdoor locations or here at our what we call service center if an in-person visit is needed. So our ESD recently relocated from Astoria to Seaside, and we are based out of the Sunset Recreation Center, or formerly Broadway Middle School. And the last thing I would add is that our staff, our ESD staff, we serve a 4-county region, Clatsop, Columbia, Tillamook, and Washington counties, and we're at approximately a 95% vaccination rate as well.
Okay, great, thank you. Lastly, we'll see if Margot Lalich, our Public Health Director, has anything to add.
I was enjoying just taking notes and sitting here quietly. Yeah, reciprocity, that gratitude, you know, it really is, it goes both ways, and our ability to work together. And the fact that, you know, we meet weekly and we have difficult conversations, and we are thought partners in trying to figure out how to keep our children healthy and ready to learn and be able to attend school. Thank you, Tom, for the data. I'm having some issues being able to upload the data right now, the dashboard, so I'm a little behind on that. I think one of the challenges, so there's 2 things that I would add to this. One is yesterday we met as a team, internal team, to look at 2 strategies for vaccination. One has to do with the booster doses for 65 and older, which isn't relevant to this conversation. And then once the approval comes forth for the 5 to 11-year-olds, what our strategy will be to have them vaccinated in partnership with our districts in a way that is very trauma informed. And so we're very much in that process, down to the details, and we'll be ready to launch when that time comes. I think one of the challenges that we face, and I think this is the heart of the conversation, is that we want our children healthy and ready to learn. We all agree we want them attending school. From my perspective, the guidance continues to get more complex. While the intentions are very good and there's good science and good minds going into it, it becomes increasingly a challenge to implement it in the local setting based upon span of control. And so in our community, we need to work together. We all agree we want children attending school. You know, there's the Swiss cheese analogy. We have many ways of protecting our students and protecting our staff. And Superintendent Prince is correct. The children aren't getting exposed in school, they're getting exposed in the community. We know this because of our case investigations and contact tracing. As adults in the community, we have a responsibility, I believe we have a responsibility to protect our children so they can receive their education. And sometimes for some kids, school is the safest place for them to be. So what we will start looking at is how we, as a local public health authority, in partnership with our superintendents, can keep it simple, can focus on what's essential, to make sure our kids stay in school. And if it means revisiting the guidance as it gets updated to the point where we say, yes, this works in our community, but this is actually preventing children from attending school, even though we have all these protective measures in place, we as a community will have a conversation about that. So that's all I have to share on that right now. And I think we'll have more. The investigative guidelines are in the process of being updated. We'll be able to see them next week. And again, it's just we built up this anticipation about children returning to schools, some level of normalcy in a situation where COVID is endemic, and it will continue to be. So what do we need to do that's reasonable to allow children to attend school, enjoy school, be protected, and use our common sense that we apply to so many other communicable diseases that are present in the school setting, and the schools and the school nurses are very well versed in how to implement those measures, when to send kids home, and how do we try to start looking at COVID within that framework and not as an isolated disease that needs to be treated differently, but how is it similar? And so, so I think those are our next steps. And I look forward to what we come up with in that process. I think it's going to be better for kids and their families and the schools.
Great, thanks, Margot. Okay, questions from our media. Go ahead.
Hi, yeah, this is Ethan Myers from the Astorian. So Steve Phillips mentioned that Jewel's staff was 90% vaccinated, I believe. So I was hoping to hear from each district about what percentage of staff will be vaccinated by October 18th, as well as just the challenges of meeting the October 18th deadline.
Yeah, Ethan, for Warrenton, we expect to be, we're about 87% now. I expect to be about 92% by that 18th deadline for our staff. And as far as the challenges meeting that deadline, it was a tight window to get, get a double, a 2-dose vaccine, plus there's a 14-day waiting period after that to hit that 18th mark. But we can sort of work backwards from that deadline. I think, again, kudos to our public health department, because they've been able to mobilize vaccination clinics on site. And I know for Warrenton, we had one September 4th, and we're having a follow-up one October 5th. And then October 5th deadline would allow someone to get either a second dose of a 2-dose vaccine or the J&J and still be able to come to work on October 19th, I believe. So that deadline, it was tight, but at least in my experience, it's very manageable.
For Napa, oh, go ahead.
For Astoria, we are over 90%. The timeline was tight, but we got on it pretty quick and gave our staff numerous different options for them. And I was pleased, to be honest, pleased to see the large number of staff who got vaccinated based on this requirement. We weren't sure how that was going to go, but a large number got vaccinated based on this mandate. So.
In Napa, we're at 92% right now. Anticipate being at 95% by the 18th. Unfortunately, to get there, we will have a couple of employees who are making a decision to no longer be with us, and we're saddened by that. We value all of our people, but we also understand that people need to make individual choices.
Are those teachers, or are those ancillary personnel who've left?
They've not left yet, but we anticipate there will be some of each.
How are the students handling the things like the mask mandate? Are they taking it very seriously, or is it a mix, or are they on board?
I can start. I mean, we've been doing this for a year. Students are great. It might be surprising, the youngest ones are the best. Kindergartners don't, now our first graders don't know school without masks. And so we taught them that's the way you do school, and that's the way they do school, and they're really good about it. We have a little bit of power struggle once in a while with some middle schoolers, but that is not specific to masks. That's specific to the nature of the middle school creature. But our kids are really good about it. They follow the rules, and they understand the why behind it. They understand it's to keep them safe, and it's not been much of an issue for us. We were Sort of wondering, because last year we were running a 5-hour day and now we're back up to normal with the extended day, how that would go, but it's been fine. They've been great.
And piggyback on that, same experience here. The younger kids, they seem to be, receiving it very well. Middle and high school kids, some pushback, but I think if it's not along the lines of for their own safety, they are more likely to see it as the means that keeps them in school, and in some cases the means that for those in extracurricular activities, it keeps them accessing those. So there's some motivation there, and we have not had a big issue with that. As Bill was saying, the mask fatigue, the wearing it all day, every day. One of the aspects that has alleviated that a bit has been the opportunity to take the mask off a little bit more freely under the new guidance this school year. And while there is an outdoor mask mandate, if the students and staff can't sustain 6 feet of distancing outside, for recesses and some other activities, that gives additional opportunity for those masks to be down and kids to have a mask break. And I think that allows the mask to be on much more readily in school as a result.
I would say the similar as what Bill and Tom did. Kids across all grades are wearing masks great. We do, like others, have to have conversation with middle school and high school, but not often. It's more signal in them. But that's also an age group where we can reason with them and explain to them that we can stay in school longer if we follow these protocols, and kids want to stay in school, so they follow. So
I've got one or two more, if that's okay. For Margot, Tom was saying that Clatsop County's got the lowest rate of COVID infection amongst pediatric group, which I imagine is the 0 through 17, I guess. Can you elaborate a little bit on that?
Oh, I wish I could. Thank you, Tom, for that statistic, but actually I can't at this moment in detail. Yeah, I was trying to pull up my dashboards earlier and yesterday, and it's an IT issue. So, this is really anecdotal, so there's no evidence to support this, but it is, we've had a lot of time to prepare for this. We have, somewhat of a good understanding about the transmission of the virus. We know obviously there's a much higher transmissibility with the Delta variant, but we're implementing as many measures as we know work to protect our children. With that said, we also know that once, Oregon opened up in June 30th and people had the opportunity to gather, whether it was in community events that have continued, we know sleepovers are continuing to happen, family gatherings are continuing to happen. And so while we have a vaccination rate in the adult population because we help protect our children, right? Creeping up, we do have situations in which, for a variety of reasons, those measures are not in place to protect all children. So kind of a broad response to your question, but hopefully next time I'll have a better answer for you, more detailed answer.
And last question from me would be, what happens when somebody, a student or staff member is infected? What's the protocol for informing parents? Is it do you inform the parents, or is it parents who are of kids in that classroom, in that school, or how do you handle that?
So I'll take that on because I also want to share with the group. We have, as the other schools do, a procedure and process we put in place where it starts with we identify a case, we contact trace, and then based on that contact tracing, we do specific phone calls or in-person meetings with either parents or staff members to let them know of the positive case, or for people who have come in close contact with them that have to quarantine. And then the final step of that is that we inform our parents at the very end of the day of any cases within our school system for that day. On Thursday, I think there's a press release either going out Thursday or Friday. We are opening up a school district dashboard that will show specifically our cases in our district, where either their kids or adults and what schools they come from. That's just another sign of transparency we want to provide for our community and for our parents. So that's in Astoria.
Thank you.
Do we have any other questions from folks, or anyone else want to address that?
I'm just echoing Craig's approach. It's sort of concentric circles, right? You try to really communicate specifically around the individuals that we're in close contact with, a positive case, those parents, that classroom, but more broadly ensure that all in our school community are aware of all the cases that have been caught on our campuses. And I use that word intentionally. We feel, as Bill said earlier, schools are really safe places for kids and staff who might come down with symptoms, because it's very difficult with all the protocols we have in place to get through a school day and not have that be called out and then looked into deeply. So when we do find that, we take those really specific steps within the classroom, if you will, and then the broad step to make sure our community is informed of all the cases we might be experiencing.
And from a public health perspective, because there's a framework for responding, right, is in preparation for this school year, what we know is the superintendents, they know their school community better than anyone, and they have those very important trusting relationships, right, and dialogue with families at all times. So we rely and we support the school districts doing their contact tracing, identifying their cases, informing the community in a way that is consistent with how they receive information already. We do get, of course, notified of those cases. And again, there is just this open line of communication, whether it's with the superintendents or our school nurses. They let us know, hey, we've got a case, we've got this going on. We also, if they're, tested, we get that lab report. So there is also that formal case investigation, right? And then we work together to make sure that there's consistency between the guidance and the school protocols, and that we've covered all the bases without overreacting, right? We want to maintain perspective. And it's been a little bumpy, as we all expected coming back to a new school year, and yet we're working through it. And we also established a nurse liaison between the schools and public health. So the nurses have a direct line to someone who's very experienced, who can triage those questions. And when those questions, there's not a really clear answer, because some of this we're figuring out, right, as we go. There's new scenarios. We work with our regional EPIs. We have a call this Friday, right? Okay, this is kind of what we're dealing with. How do we translate this? How do we interpret this? What is always in the best interest of the school and students? So it's multi-layered, but the schools, we have complete confidence in the schools and their protocols. They know what they're doing.
And I also just shout out to our school nurses. When you think about the two fronts that are getting hit hard by this, you had the healthcare front, and then you have education front, and they're at the crux of both of those. And our nurses are on our weekly meetings as well, and you talk about above and beyond work throughout this. I know in our district we could not have stayed safe and operating school concurrently without their work. So shout out to them as well.
Absolutely.
Okay, any other questions?
Well, I would be remiss to not piggyback on the school nurse, just because I have been working in that realm for almost the last decade. You know, I think that there are really three health systems. There's the public, the private, and we actually have a health system within the school setting. And most people just don't think about it that way. And whether it's staff or students who visit our traditional healthcare settings, whatever is they have or they acquire or experience in terms of their health or illness comes to school. And it's the schools, while their primary responsibility is to educate, they also have to accommodate and manage whatever that specific health situation is. And so when we think about infrastructure and ratios and staffing shortages, we tend to go to clinics and hospitals. But when you really think about it, our school nurses aren't responsible for 2, 3, 4, 5 patients. They're responsible for hundreds of patients every single day. And so to reiterate, you know, Tom's comment and shout out to school nurses, it is extraordinary what they do, particularly in extraordinary times like this. And that we actually do as well as we do is just remarkable. So yeah, extra shout out to them.
If I may, I'm going to put a plug out here. Between our school districts, we need 9 bus drivers right now. There's a shortage in the market, not just driven by the COVID vaccine, but just driven by shortages of CDL people, you know, different pieces that are just all coming together at once. So I would love it if the media could let people know that it's rewarding work, it's fun work. You get to interact with kids, you get to serve your community. All of our districts would be glad to have applications from bus driver applicants right now. And we train them, and it is good work, and it's a way to give back to your community, and it's fun too. So I'll put that out there.
And to note that it's not just PPE and other resources that have been, you know, requests to the Emergency Operations Center as part of this pandemic response. There has been a formal request through the Emergency Operations Center for bus drivers. We're thinking about where the National Guard are right now, that it is an emergency and we need bus drivers to take children to school. And so there has been a formal request submitted.
Okay, any more questions? All right, if do any of our participants have any you know, closing thoughts or things they'd like to share? Well, if not, thank you everyone for participating. I think we've shared some really valuable information with the community. Hopefully we can make these regular occurrences. And so I'll ask our media folks if to excuse themselves, and then Margot and the superintendents will proceed with their regular weekly meeting.